Africa is on X.
At Africa Melane.
9 minutes now, it is to 5 o'clock. Let me get it right. Diabetes is now South Africa's leading cause of death, with experts warning that poor diets, limited screening, and increasingly sedentary lifestyles are contributing to this crisis. Here to talk us more about this is the CEO and co-founder of Sweet Life Diabetes. That's Bridget McNulty. Bridget, a very good morning and welcome to the show.
Good morning, Africa. Thank you so much for having me.
Shall we first talk about your organization, actually, aptly named Sweet Life Diabetes? What is it and what do you guys do?
So Sweet Life Diabetes Community is South Africa's largest online diabetes community. We have a very specific focus on empowering South Africans with diabetes through education and community. So our website, sweetlife.org.za, has answers to all your diabetes questions. We have an amazing panel of experts, and we kind of translate their doctor speak into easy to understand language. And then we have a huge community on Facebook, South Africans with Diabetes, and Instagram, sweetlife.org.za. And we're a non-profit and a public benefit organization, and we create kind of building blocks of education around what diabetes is and how to live a healthy, happy life with it. And we distribute those for free around the country.
And why do you think that we have so many South Africans living with diabetes?
I mean, it's such a tricky condition in Africa. So there's type 1 diabetes, which is the one I have. That's around 10% of people, but 90% of people have type 2. And type 2 can go undiagnosed for up to 10 years because the symptoms, which I'm just going to throw out there in case anyone listening has any of them, they can go unnoticed. So it's extreme thirst, extreme hunger, needing to pee a lot, especially at night, feeling tired, and blurry vision. So if you have any of those symptoms, I'd really encourage you to go and get a simple finger stick blood test. But as you can tell from listening to them, you can kind of explain a lot of those away. And also, no one really wants to get diagnosed with diabetes because there's this perception that then you'll have to give up eating your favorite foods and then you're at risk of all these complications. And so a lot of the time, I think ignorance is bliss and people just don't get diagnosed. And then by the time they are diagnosed, it's quite severe. Like the condition has progressed a lot. And so that's why it's leading to deaths. The thing that drives me nuts about this is that diabetes is not a lethal condition. Type 2 diabetes, if managed correctly, you can live a perfectly long and healthy life, and yet it's killing so many people in South Africa. It's infuriating.
As you were listing those symptoms to look out for, some people could say, well, it's a factor of age, right? I'm now a certain age, and of course my eyesight is not going to be quite as good as it was 5 years ago, and explain away the blurriness in what you're able to see. I mean, I don't imagine how you can explain away having to wake up in the middle of the night to go to the loo. But
well, if you're drinking lots of water,
that is true. That
you
is
can say,
true.
I'm warmer. I'm trying to drink more water at the moment. Or also age. Like you wake up more, the older you get, the more often you wake up, the more likely you are to wake up in the night to pee. Exhaustion, everyone's exhausted. The extra hunger is a trickier one to explain away, but then you can say like, I've been working so hard lately, or I'm trying to exercise more. Like, I think humans are very creative when it comes to explaining away symptoms that they don't want to have.
And I imagine we won't discuss the details of it now, but if you couple diabetes with the other massive health concern in South Africa in many parts of townships and certainly here in Cape Town and the Cape Flats, that of high blood pressure, the combination can be very, very, deadly actually in some cases.
Yeah, absolutely, because that's also the silent killer. And the thing is that it's so easy. So the kind of the message that we try to share is that diabetes isn't a scary thing. Like a lot of people say, when I was diagnosed, it felt like a death sentence. It's not a death sentence. You can live such a normal life with diabetes, and you'll have to make some lifestyle changes, but it's not like in the olden days. I think they used to tell you that you had to eat this super strict diabetes diet and like all joy would be gone from your life. That's not the case at all. And so the earlier you can get diagnosed, we encourage an annual finger-stick blood test. It takes less than 5 minutes. You can get a number straight away. You can get it at your local clinic or nearest pharmacy. And then that tells you if you're at risk of developing type 2 diabetes or if your blood sugar is already higher than it should be. And then you can take action. You can take proactive action before your body is taking strain. And that's a beautiful way to approach a condition, because then you're starting so strong.
And that's the magical thing about particularly the type 2, and we'll talk briefly about type 1 in a moment, Bridget, which is slightly more complicated. But sometimes it is as simple as, you know what, walk for a kilometer a day and do it every day to a, even more higher intensity as time progresses, and that will make a significant difference in your health.
I mean, type 2 diabetes, we often will say to people that it's also an opportunity, right? If you get diagnosed early enough, it's reversible through changing your diet and often losing a bit of weight. Like that's one of the risk factors, is carrying extra weight, particularly around the stomach area. And then if you're diagnosed a little later, you have to take tablets, a version of metformin, and you'll have to take a tablet every day. But that's also not the end of the world. And it is a progressive condition, so with time you'll have to take insulin injections. But it's not, none of it is terrifying. It's all very manageable. And as you said, there's lifestyle changes you can make. So the mnemonic that we have to make it easier to remember is TEAL, TEEL. And that's the 4 things you have to remember to manage your diabetes. So T is for take your medication every day as your doctor prescribes. E is for eat healthy food. E is for exercise a little each day. And L is for lose weight if you need to. And those are like the basics for how to manage diabetes. And we interviewed all of South Africa's top diabetes experts and then got it down to that. So it's not rocket science. It is possible. But at the same time, it requires effort.
Absolutely. Type 1, as I said, is a little bit more complicated.
Type 1 is an autoimmune condition, so it's genetic but not hereditary, and it's often the diagnosis comes out of the blue, no one in your family has it, and it's a very sudden and dramatic onset. So most people end up in hospital, and you have to go on to insulin injections or an insulin pump immediately and for the rest of your life. So every time I eat, I have to inject, and then you have to test your blood sugar throughout the day to know if it's going too high or too low, and kind of ideally walk a very calm tightrope between too high and too low. So yeah, it's more challenging. It's apparently we make 180 extra health decisions a day living with type 1 diabetes, but also manageable and also hugely beneficial to have a community. Like one of the hardest things when you're first diagnosed with diabetes of any kind, but type 2 runs in families, so people often know others with diabetes. So when I was first diagnosed, I was the only one, and I felt so lonely, and like I was the only one who was dealing with this. And so that's why we started Sweet Life, is to show that, hey, we get it, totally sucks. Some days are good, some days are bad, but at least you're not alone in it.
Absolutely. And that community you can find by going to sweetlife.org.za. Bridget, thank you very much for your time and your insights this morning. Bridget McNulty is the Chief Executive and Co-founder of Sweet Life Diabetes, talking to us about how diabetes is now South Africa's leading cause of death. The majority of people with diabetes have a type 2, and that can be managed, particularly if you diagnose it early. So as she recommends, please make sure you go for a test. Type 1 is slightly more complex and requires a lifelong intervention in order to manage your bandwidth, for lack of a better word, of how much sugar you have in your system. Sweetlife.org.za is the URL that you need to go to for that community.